When we think about frailty, what frailty measurement tries to do is it tries to put age in a context. It's intuitive that all older adults are not the same. Some 83-year-olds are fully functional, continuing to work, exercising all the time, physically and cognitively, 60 for all intents and purposes. And other people of the same age, unfortunately already are starting to show some of the complications related to aging, some disability, they may not be able to take care of themselves. And we know that disease, how many diseases people have had over the course of their lifetime, certainly impact that. But what frailty tries to do is it tries to understand what we call the aging phenotype. How has the process of aging affected this particular individual? And we know from the geriatric literature and work that's been done that by measuring frailty, we can begin to conceptualize how frail a person is, how old they are, so to speak, on the inside, and how much reserve they have. So can this older adult tolerate the day-to-day challenges, the challenges that illness imposes on the system, and challenges that procedures impose on the system? Can they suffer an adverse event or undergo an invasive procedure and bounce back like they were 40 or 50 or 60? Or is it going to be, unfortunately, a big burden on them and maybe they won't recover? So we piloted and implemented the frailty elements that we studied in this study. We measured 15-foot walking speed. It's a simple test. We ask a patient to walk across the hallway, and we see how long it takes. And you'd be surprised what we see. Sometimes patients who we think seem very frail and debilitated can zip across the hall, and other times, people are much slower. And it's that picture is worth 1,000 words. We measure grip strength to understand weakness and muscle strength and quality. We ask about activities of daily living, which capture independence. Can a patient fully care for themselves and be independent in the home, or do they unfortunately require assistance getting dressed or taking a shower and other activities? And lastly, we measure serum albumin as an index of malnutrition. What we found is that 30-day complications are similar between those who are considered frail by the score and those who are considered less frail by the score. There's no difference in 30-day death, cardiovascular death, stroke, bleeding. And that may be a reflection of the small number of those events that we found, but I actually think it's a reflection of how well tolerated transcatheter valve really is, that even among these very frail patients, the procedure was well tolerated. What we did find, though, is that when you look out to 1 year, the events in the frail group begin to accumulate. There's a statistically significant increase in mortality seen in the frail group compared to the group that's less frail. About 36% of the frail group are dead at 1 year, compared to only 16% of the group that's less frail. There are a couple of take-home messages. The first is the group of patients that were treated in the Partner 1 trial are an extremely frail group. When we look at some of the functional aspects of the frailty score, walking speed and grip strength, even among the group that we categorized as less frail, the non-frail group, their walking speed and grip strength were both markedly lower than those seen in the general population. That's a reflection of the fact that most studies of frail patients include an overall younger patient group, Our patients have an average age of 85, but also that these are the frailest of the frail. They have so many comorbid conditions, and they're so sick from their aortic stenosis, and that has a real impact on their frailty status. So this is the frailest of the frail, and yet they seem to tolerate the procedure and don't have acute complications. So that's the first take-home message. The second take-home message is that when patients are at the extreme of frailty, like the frail group in this study, that certainly impacts their prognosis after the procedure. Compared to medical therapy, there is certainly a benefit of transcatheter valve in the overall population. But we need to be careful when we look at patients in the extremes of frailty, whether we think that they stand to derive a benefit long term. So what we did was we evaluated the impact of frailty not only on mortality but on poor outcome. And not surprisingly, both at 6 months and at 12 months, the frail group experienced a higher rate of poor outcome. When we looked carefully to evaluate what drove the poor outcomes in this study, we found that at 1 year, most of the poor outcomes were driven by death. But at 6 months, even when we took out the deaths, there was a strong trend towards a higher quality of life in the group that was less frail compared to the group that was more frail. What I'd like people to take away from this is measure frailty in older adults with cardiovascular disease when you're making important decisions. The picture is dramatically enhanced when you begin to understand not just the cardiovascular vantage point, but when you look at the whole patient and you can contextualize their cardiovascular disease and in the context of how frail they are and what their overall medium-term prognosis is because of their frailty.